Bismillahirrahmanirrahim. Our today's topic is pernicious anemia. It is one of the most important topic in the viva and also in written questions. So I will try to solve all the queries of yours about pernicious anemia. So at first we have to know the definition of pernicious anemia. Pernicious anemia is a chronic disorder of middle or old age, and the basic pathological lesion is gastric atrophy, which result in vitamin B12 deficiency. অর্থাৎ পার্নিশিয়াস অ্যানিমিয়া মূলত মিডল এবং ওল্ড এজ পিপলে এবং যাদের গ্যাস্ট্রিক অ্যাট্রফি আছে, আর গ্যাস্ট্রিক অ্যাট্রফিটা মূলত ভিটামিন B12 ডেফিসিয়েন্সির জন্য হয়ে থাকে, তাদের পার্নিশিয়াস অ্যানিমিয়া হয়ে থাকে। Then the pathogenesis. Fundamental defect in pernicious anemia is a failure of secretion of intrinsic factor by the stomach due to the permanent atrophy of the gastric mucosa. In the absence of intrinsic factor, the vitamin B12 of food is not absorbed, result in vitamin B12 deficiency. তাহলে আমরা সহজেই বুঝতে পারছি যে পার্নিশিয়াস অ্যানিমিয়াটি কেন হয়। Then we have to know the factors of pathogenesis. Genetic factor, autoimmune factor. These are the two factors. In genetic factor, blood group A is common among the patient and their relatives than in the general population. In autonomic factor, two types of antibody form: parietal cell antibody and intrinsic factor antibody. Then a very important topic is clinical features. The clinical features of pernicious anemia is middle or old age group, is insidious anemia, glossitis, nervous system manifestation, paranesthesia in the feet. Characteristically bilateral and symmetrical and spread gradually up the leg to the thigh. Gastrointestinal manifestation like diarrhea, then anorexia, weight loss, mental disturbance, visual disturbance. Then the laboratory diagnosis. The laboratory diagnosis of pernicious anemia is same as the megaloblastic anemia, only a few difference. And we have already discussed about the megaloblastic anemia's laboratory diagnosis in our previous video. So we do not want to tell this in this video because it will be quite longer. So I will tell only dissimilar topic which helps you. So the blood picture, peripheral blood film and bone marrow all are same as the megaloblastic anemia, but it is different in biochemical test. In biochemical test, serum bilirubin is usually at the upper limit of the normal but may be slightly increased. Serum heptoglobin level is reduced, serum ferritin and iron is elevated, plasma lactate dehydrogenase invariably increased, serum folate usually normal, red cell almost always reduced. Detection of vitamin B12 deficiency. Main test is the serum vitamin B12 assay by the radioactive vitamin B12 absorption test, which is Schilling test. This test is essential for the definite diagnosis of pernicious anemia. Serum intrinsic factor antibody test. Presence of intrinsic factor antibody is strong evidence in the favor of diagnosis of pernicious anemia. So this is all about pernicious anemia. Hope you liked the video. Thank you so much.